Could it be true? Are you like over 80% of people completely in the dark about the most powerful life-enhancing secrets hidden within that humble box of baking soda sitting in your kitchen? That's right. Millions of homes are unknowingly overlooking the incredible potential of this common, inexpensive ingredient, a substance that costs mere pennies per dose, yet holds the key to a surprising array of health benefits. Many specialists quietly regard baking soda as perhaps the most underappreciated, versatile, and astonishingly effective natural remedy in the world. Pause for a moment and consider how many times have you reached for baking soda to whip up a cake, freshen your refrigerator, or scrub a stubborn stain, all without a second thought to its profound, untapped potential. What if you were told that this unassuming white powder boasts a long and storied history of unexpected applications, some of which could radically change how you think about your health and well-being? Imagine possessing a simple, affordable tool that could soothe ailments, enhance your physical performance, and even support your body's natural defense mechanisms. Why is this knowledge not common parliament? What incredible benefits are most of us missing out on? And why do so few people truly discuss the remarkable, multifaceted power of baking soda? The truth is, this everyday substance harbors amazing health advantages that remain largely unknown to the general public. This exploration will delve deep into these benefits, illuminating how baking soda can be a game-changer for your health. Crucially, we'll also outline vital safety measures and identify specific individuals who must exercise caution, ensuring you can make wise, informed decisions on your journey to improved health. If you're ready to unlock these secrets and transform your understanding of this kitchen staple, you absolutely don't want to miss what's coming next. Beyond its well-known roles in baking fluffy cakes and keeping our homes sparkling clean, baking soda or sodium bicarbonate emerges as a surprisingly potent ally in supporting the body's natural detoxification processes. When dissolved in water, this simple white powder transforms into an alkaline solution capable of neutralizing acids both externally and internally. This property is popularly leveraged in baking soda baths, a time-honored home remedy for soothing irritated skin conditions like mild rashes and insect bites, reducing itchiness and calming inflammation. The theory suggests that soaking in a baking soda solution can help draw out impurities from the skin, leaving your body feeling more balanced and your skin wonderfully refreshed and smooth. While extensive scientific validation for its skin detoxification prowess is still developing, countless users worldwide anecdotally report significant relief and an enhanced sense of ease after such a bath. Internally, the story of baking soda's detoxifying potential becomes even more compelling. Some health enthusiasts advocate for alkalizing the blood and urine by consuming a small, carefully measured amount of baking soda mixed with water, believing it aids the body in eliminating accumulated toxins. This isn't merely conjecture. There's a degree of scientific backing, particularly for individuals grappling with specific medical conditions. For instance, in cases of chronic kidney disease, sodium bicarbonate supplements have been shown to help slow the disease's progression by mitigating the buildup of acid in the blood. A notable study published in the Journal of the American Society of Nephrology highlighted that under strict medical supervision, baking soda can indeed enhance the body's natural detoxification pathways, especially for those who require assistance in managing their internal acidity levels. However, it's absolutely crucial to remember that our bodies are remarkably adept at maintaining their own pH equilibrium. Drastic attempts to alter this balance can be challenging and potentially harmful if not approached with caution. Moderation is paramount as excessive baking soda intake can lead to adverse effects. When used judiciously and appropriately, baking soda can offer a gentle, remarkably inexpensive method to support your body's inherent detoxification mechanisms, leaving you with a revitalized sense of well-being. There's a very good reason why baking soda is a star ingredient in numerous commercial toothpastes and a staple in many do-it-yourself dental care routines. It's a veritable powerhouse when it comes to achieving a whiter smile and promoting overall dental wellness. If you've ever brushed your teeth with a touch of baking soda, you've likely experienced that incredibly clean, smooth sensation it leaves behind. This is because baking soda acts as a gentle yet effective abrasive. It works diligently to lift and remove surface stains that accumulate from daily consumption of tea, coffee, red wine, and other pigmented foods and drinks, which can otherwise dull the natural brilliance of your smile. When applied correctly, its fine texture helps to polish the teeth, restoring their luster without causing the significant harm that harsher, more aggressive whitening treatments might inflict. However, the benefits of baking soda for your oral health extend far beyond cosmetic whitening. Its alkaline nature plays a crucial role in balancing the acidic environment within your mouth. This is incredibly important because an overly acidic oral environment creates a breeding ground for harmful bacteria, the very culprits responsible for tooth decay, cavities, gum disease, and persistent bad breath. By neutralizing these acids and helping to restore a more balanced pH in your mouth, baking soda makes it significantly less hospitable for these detrimental microorganisms to thrive, thereby supporting healthier gums and fresher breath. These assertions aren't just old wives' tales. They are substantiated by scientific research. For instance, a study featured in the Journal of Clinical Dentistry found that toothpaste containing baking soda were substantially more effective at removing plaque and whitening teeth compared to their counterparts without this key ingredient. Another piece of research indicated that baking soda could significantly improve oral health by reducing the populations of harmful bacteria in the mouth. Nevertheless, moderation remains key due to its mild abrasiveness. Excessive or overly vigorous brushing with baking soda can over time lead to the erosion of tooth enamel. Dentists generally advise using it sparingly, perhaps only a few times a week, and always in conjunction with a soft bristled toothbrush. When used thoughtfully and correctly, baking soda can be a remarkably quick, incredibly low-cost, and convenient pathway to achieving a healthier, whiter, and noticeably cleaner smile, all from the comfort of your home. Heartburn, that familiar and often intensely irritating burning sensation, is a common affliction for many, particularly after indulging in a rich, spicy, or overly large meal. This discomfort typically originates from acid reflux, a condition where stomach acid flows back up into the esophagus, causing a burning feeling in the upper stomach that can sometimes radiate up into the throat. Factors such as pregnancy, excess body weight, and certain medical conditions like eosinophilic esophagitis or achalasia can further elevate the risk of experiencing heartburn. While the shelves of Armicides are lined with a plethora of commercial antacids, a surprisingly quick, effective, and readily available solution might already be residing in your kitchen pantry. Mixing a simple teaspoon of baking soda into a glass of water and sipping it gently is a tried and true method for achieving almost instantaneous relief from the fiery grip of heartburn. The science behind this rapid relief is wonderfully straightforward. Baking soda, being alkaline in nature, acts to neutralize the excess stomach acid that is causing the burning discomfort. This chemical reaction has been a cornerstone of home remedies for generations, offering near-immediate comfort to those in distress. In fact, the medical community formally recognizes sodium bicarbonate as a fast-acting antacid. A comprehensive review published in the esteemed journal Gastroenterology and Hepatology confirmed its efficacy in providing rapid relief for sporadic episodes of heartburn. The procedure is incredibly simple and easy to understand. There's no need for expensive treatments or an urgent dash to the pharmacy. All that's required for effective relief is a glass of water, a teaspoon of baking soda, and a few moments of your time. This remarkable simplicity and effectiveness are precisely why baking soda continues to be a cherished and indispensable item in households around the globe. For anyone seeking immediate, dependable relief from heartburn, this common kitchen ingredient can make a significant difference, allowing you to swiftly return to your day with ease and comfort. Fungal infections, a common and often persistent annoyance, can manifest as itchy, red, or flaky patches on the skin. Conditions like athlete's foot, ringworm, and other similar fungal disorders are typically caused by fungi that flourish in warm, moist environments, making areas like the feet particularly susceptible, especially in humid climates. While numerous over-the-counter creams, sprays, and powders are available to combat these infections, baking soda presents a straightforward all-natural alternative that you likely already have in your kitchen. The potent antifungal properties of this ubiquitous household item stem from its remarkable ability to alter the environmental conditions that fungi require to grow and proliferate. When applied to the skin, baking soda creates a more alkaline environment, which is inhospitable to fungal cells. This alkaline shift can disrupt the integrity of fungal cell walls, making it significantly more difficult for the fungi to survive, multiply, and cause infection. This isn't merely a folk remedy passed down through generations. There's tangible scientific evidence to support its efficacy. A compelling study published in the journal Mycopathologia investigated the impact of baking soda on various fungal strains. The research revealed that a solution containing just 10 grams of baking soda per liter of water was capable of inhibiting the growth of an astounding 80% of the fungal strains tested. This remarkable outcome underscores the significant potential of baking soda as a natural and effective antifungal agent for conditions like athlete's foot. A simple and effective remedy involves creating a paste from baking soda and a small amount of water and applying it directly to the affected areas. Alternatively, adding baking soda to a foot soak can also provide relief. Many individuals report a noticeable reduction in itching and discomfort after just a few applications. Furthermore, because it is non-toxic and generally soothing to the skin when used appropriately and not on broken skin for prolonged periods, it's a fantastic option for those who prefer to avoid harsh chemicals often found in conventional treatments. This accessible and incredibly reasonably priced treatment offers a viable and effective option for anyone battling stubborn fungal infections, helping to restore comfort and confidence in daily life. Urinary tract infections, or UTI, are a prevalent and frequently excruciating issue disproportionately affecting women. The characteristic burning sensation during urination, a persistent and urgent need to urinate, and general pelvic discomfort can make daily life incredibly challenging. While antibiotics are the standard medical course of therapy for UTI, some individuals actively seek natural remedies to help alleviate symptoms and support the body's healing process. Baking soda is one such traditional treatment that has garnered considerable interest for its potential supportive role. The theory underpinning its use for UTI relief lies in baking soda's well-established capacity to neutralize acids. When a small, carefully measured amount of baking soda is dissolved in water and ingested, it can help to make the urine less acidic. This alteration in urinary pH, it is believed, can create an environment that is less conducive to the growth and proliferation of the bacteria responsible for causing the UTI, thereby assisting the body in its fight against the infection. Furthermore, less acidic urine can significantly lessen the intense burning sensation that makes UTI so uncomfortable, providing welcome symptomatic relief. There is some scientific evidence to lend credence to this approach. For instance, a study published in the Japanese Journal of Urology involved 33 women suffering from recurrent urinary tract infections who were treated with sodium bicarbonate. After a 4-week period, a significant number of participants reported a marked improvement in their symptoms, including a notable decrease in pain and discomfort during urination. While these findings are certainly encouraging, it is absolutely crucial to emphasize that baking soda should never be used as a substitute for prescribed medical therapy for UTI, especially in cases that are severe or persistent. However, for individuals seeking additional complementary relief alongside authorized medical treatment, baking soda might offer a mild, cost-effective way to help ease discomfort. Always remember, though, that severe or ongoing UTI symptoms necessitate immediate medical intervention. When used judiciously and as a supportive measure, baking soda can be a useful addition to your toolkit for managing urinary comfort and promoting overall urinary tract health. If you've ever experienced the sharp stinging pain of a canker sore, you understand just how upsetting these small but mighty mouth ulcers can be. They can make eating, drinking, and even speaking a painful ordeal. The good news is that baking soda, that ever-present kitchen staple, could be the simple, incredibly low-cost solution you've been searching for. Canker sores, medically known as ulcers, are often triggered by factors such as stress, minor oral traumas, like an accidental cheek bite, or even sensitivities to certain foods. Their presence can cause significant discomfort and irritation. Baking soda or sodium bicarbonate works its wonders in this situation due to its unique ability to neutralize the acids present in the mouth and establish a more balanced, less acidic pH environment. This is critically important because an acidic environment can exacerbate the discomfort associated with canker sores and potentially impede the natural healing process. By simply rinsing your mouth with a solution of baking soda and water, typically about half a teaspoon dissolved in a glass of warm water, you can help to reduce inflammation, ease the associated pain, and potentially hasten the healing process. But don't just take anecdotal evidence for it. Science lends support to this practice. A study published in the prestigious Journal of the American Dental Association found that in patients suffering from recurrent athos stomatitis cankerous, the use of sodium bicarbonate mouthwashes significantly reduced discomfort and accelerated the healing of the ulcers. The researchers noted that the mild antiseptic and anti-inflammatory properties of baking soda help to keep the sore cleaner and inhibit further bacterial growth, both of which are crucial for effective healing. Additionally, baking soda is generally quite gentle and is less likely to aggravate the sensitive tissues of a canker sore compared to some stronger over-the-counter remedies that might contain harsher ingredients. So the next time you feel the unwelcome onset of a canker sore, try reaching for a simple baking soda rinse. It's a natural, scientifically supported method readily available in your kitchen that can bring soothing relief and promote better oral health. Did you realize that a simple, unassuming item from your kitchen pantry could potentially give you a significant edge in your fitness endeavors? Yes, that familiar box of baking soda can be used for much more than just cleaning your sink or leavening your cakes. Athletes and fitness enthusiasts have been quietly using it as a secret weapon to combat muscle fatigue and enhance their exercise performance. Here's how this fascinating process works. During high-intensity exercise, your muscles naturally produce and release lactic acid. This accumulation of lactic acid leads to a decrease in the pH within your muscle cells, creating that recognizable burning sensation and contributing significantly to muscle tiredness. This acidity is a primary factor in muscle fatigue, often forcing you to slow down or stop your workout before you feel you're truly ready. Sodium bicarbonate, the chemical name for baking soda, acts as a natural buffering agent. When ingested prior to exercise, it helps to neutralize or buffer the excess acid that builds up in your muscles. This buffering action can delay the onset of fatigue, allowing you to push harder and sustain your performance for longer periods. This isn't merely fitness folklore or wishful thinking. It's grounded in solid scientific research. A comprehensive meta-analysis of numerous studies published in the Journal of Strength and Conditioning Research concluded that supplementation with sodium bicarbonate significantly improved performance in short-duration and high-intensity exercises. This includes activities like cycling, swimming, sprinting, and resistance training. The researchers found that athletes who consumed baking soda before their workouts were able to maintain their optimal performance for extended durations and experienced a delayed onset of weariness and fatigue. Typically, athletes will mix about a teaspoon of baking soda with water and consume it approximately 60 to 90 minutes before their training session. However, it is absolutely essential to start with very small doses, as ingesting too much baking soda or taking it too close to exercise can sometimes lead to gastrointestinal side effects, such as nausea, bloating, or stomach discomfort. If you're searching for a natural, scientifically supported method to potentially boost your endurance, push past your perceived limits, and maximize the effectiveness of your training sessions, baking soda might be worth exploring. But always remember to consult with a healthcare provider or a sports nutritionist before incorporating it into your routine, especially if you have any underlying medical conditions or concerns. Try it cautiously, and you might just discover a surprising difference in your next workout. Imagine if a substance as basic and readily available as baking soda could play a role in nourishing and protecting your kidneys, particularly for individuals navigating the challenges of chronic kidney disease, CKD. For many people living with CKD, their kidneys struggle to adequately remove acid from the blood, leading to a condition known as metabolic acidosis. This persistent overabundance of acid in the system can negatively impact overall health and crucially can accelerate the progression of kidney disease itself. This is where sodium bicarbonate, the familiar baking soda, can offer a surprising benefit. By acting as a natural antacid, it helps to neutralize and balance the excess acid present in the bloodstream. In doing so, baking soda can potentially lessen the daily strain on already compromised kidneys and may even help to slow down the advancement of kidney disease by mitigating this harmful blood acidity. This isn't just a hopeful home remedy. There's compelling scientific evidence to support this potential. A seminal study published in the highly respected Journal of the American Society of Nephrology focused on patients with severe chronic kidney disease who also presented with metabolic acidosis. The researchers made a striking discovery for those patients who received daily sodium bicarbonate tablets. The rate of deterioration in their kidney function was significantly slower compared to those who did not receive the supplement. In fact, the group taking baking soda exhibited a notably lower likelihood of progressing to end-stage renal disease, which often necessitates dialysis or a kidney transplant. The study also observed significant improvements in blood bicarbonate levels, a key indicator of the body's acid-base balance among the participants receiving baking soda. Naturally, it is profoundly important to remember that baking soda is not a panacea or a standalone cure for kidney disease. It should never be used as a supplement for kidney health without the explicit approval and ongoing supervision of a qualified doctor. Excessive consumption, particularly in individuals with pre-existing heart or kidney problems, can lead to complications such as high blood pressure or fluid retention due to its sodium content. Therefore, before even considering baking soda as a supplemental therapy, it is imperative to consult with a healthcare provider. Nevertheless, for individuals diagnosed with chronic kidney disease, this common kitchen item, when used appropriately and under strict medical guidance, may offer a surprising and meaningful impact on kidney health and overall quality of life. Imagine finding potential relief from the persistent discomfort associated with arthritis by using baking soda, a commonplace item that very likely already resides in your kitchen cabinet. Arthritis, and particularly autoimmune forms like rheumatoid arthritis, RA, is characterized by chronic inflammation that leads to debilitating joint pain, swelling, and stiffness, significantly impacting day-to-day living and quality of life. While the majority of individuals battling these symptoms typically rely on a combination of medication and physical therapy for relief, emerging research intriguing suggests that humble baking soda might offer a convenient, safe, and complementary approach to managing these inflammatory conditions. The science behind this potential is both fascinating and hopeful. A notable study published in 2018 in the Journal of Immunology indicated that consuming a daily solution of baking soda dissolved in water could have a measurable impact on the body's immune system. The study proposed that sodium bicarbonate, when ingested, helps the body to trigger its own anti-inflammatory response, effectively calming the overactive autoimmune activity that drives inflammatory diseases like rheumatoid arthritis. Researchers observed that in both human and animal participants, there was a discernible shift in the balance of immune cells towards a less inflammatory state, accompanied by a noticeable decrease in key inflammatory markers. This suggests that baking soda may play a role in encouraging the immune system to relax its attack on the body's own tissues, thereby potentially lessening the joint discomfort, pain, and swelling that are major challenges for people living with arthritis. This line of research opens up genuinely exciting possibilities for individuals grappling with arthritic conditions. The prospect that incorporating a simple, inexpensive baking soda, drink or rinse into one's daily routine could contribute to reducing inflammation and improving joint comfort is both encouraging and motivating. It's a powerful reminder that sometimes the most effective solutions, or at least supportive ones, can be found in the most obvious and accessible places. Although further comprehensive research is undoubtedly required to fully understand the long-term benefits and optimal application, this initial evidence serves as an inspiring indication that common household items may hold untapped therapeutic potential. Gout, a particularly excruciating and often debilitating form of inflammatory arthritis, typically manifests with sudden severe attacks of pain, intense redness, warmth, and swelling in one or more joints, most commonly affecting the big toe. The underlying culprit behind these agonizing flare-ups is an accumulation of excess uric acid in the bloodstream, a condition known as hyperuricemia. This surplus uric acid can crystallize within the joints, forming sharp needle-like crystals that trigger intense inflammation and the characteristic severe pain of a gout attack. Consequently, managing gout effectively often hinges on finding strategies to reduce these elevated uric acid levels and alleviate the profound pain and inflammation that ensue during an attack. It is in this context that sodium bicarbonate or common baking soda can be employed as a home treatment that demonstrates remarkable potential and efficacy for some individuals. Because baking soda is an alkaline substance, it possesses the ability to help neutralize excess uric acid in the blood. By doing so, it can reduce the likelihood of those painful uric acid crystals forming within the joints. By assisting the body in restoring a more balanced pH, baking soda may therefore lessen both the frequency and the intensity of gout attacks. Indeed, medical approaches sometimes involve alkalinizing agents, and sodium bicarbonate can theoretically aid in the dissolution of existing uric acid crystals and encourage their elimination from the body through urine, thereby providing relief from the acute, often unbearable symptoms of gout. While direct large-scale clinical trials specifically on baking soda for gout are still evolving, anecdotal evidence and smaller studies often referenced in rheumatology literature, like that which might appear in journals such as Arthritis and Rheumatism, suggest that many individuals find relief during a flare-up. Some people report that consuming a glass of water with about half a teaspoon of baking soda dissolved in it helps to reduce discomfort and shorten the duration of the attack. In addition to potentially alleviating pain, baking soda may also help lessen the joint inflammation associated with gout, which would in turn facilitate easier and less painful mobility. However, it is absolutely crucial to remember that while baking soda can be a useful addition to your gout management arsenal, it should always be used under the guidance and supervision of a doctor, especially if you are on other medications or have underlying health conditions. This ensures that you can safely reap the potential benefits without running the risk of any complications such as altering the efficacy of prescribed medications or impacting blood pressure due to its sodium content. Therefore, if you are searching for a natural, scientifically plausible method to help manage the debilitating symptoms of gout, baking soda might just be the simple, accessible remedy you need, sourced directly from your kitchen cabinet, but always in consultation with your healthcare provider. When the inevitable cold and flu season arrives, bringing with it a cascade of unwelcome symptoms like a scratchy, sore throat, a persistently stuffy or runny nose, and relentless congestion, it's all too easy to feel completely overwhelmed and miserable. However, did you know that baking soda, that straightforward, remarkably inexpensive, and ubiquitous household staple, can serve as a potent and effective ally in your battle against these prevalent seasonal illnesses? The inherent alkaline qualities of baking soda can play a significant role in helping to break down and loosen stubborn mucus, thereby facilitating easier clearance of your nasal passages and promoting improved, less labored breathing. This can be particularly beneficial if you're struggling with a persistently runny nose or a deeply congested, blocked-up feeling that makes breathing uncomfortable. One of the most effective and time-honored ways to utilize baking soda for cold and flu relief is by goggling with it. Creating a simple solution by combining about half a teaspoon of baking soda with a glass of warm water produces a wonderfully soothing remedy that can help to ease the discomfort of a sore, inflamed throat. Beyond merely alleviating pain, goggling with this mixture also helps to reduce the concentration of bacteria and germs in your throat and mouth. This creates an oral environment that is less conducive for viruses to thrive and multiply, potentially shortening the duration or lessening the severity of your illness. Indeed, a study published in the Journal of the American Dental Association, while primarily focused on oral health, suggested that frequent goggling with a baking soda solution can significantly reduce throat discomfort and lower the microbial load in the oral cavity, thereby promoting a quicker recovery from upper respiratory infections. To further aid in clearing congestion, a small amount of baking soda can also be carefully added to saline nasal rinses, enhancing their effectiveness by neutralizing acids and helping to break down mucus. Baking soda strengthens your body's natural defenses and can contribute to a speedier recovery. Therefore, the next time you find yourself feeling under the weather with cold or flu symptoms, consider reaching for some baking soda. It's a gentle, scientifically supported home treatment that can make a significant and positive impact on how quickly you recover. Once again, demonstrating that sometimes the most effective remedies are those that are simplest and already found right in your own kitchen. While it may seem an unlikely candidate, the potential role of baking soda in supporting cancer therapies is an area of growing interest and careful investigation within the scientific community. It is widely recognized that acidic environments can promote the proliferation and aggressiveness of cancer cells. Furthermore, this acidity within the tumor microenvironment can also increase the resistance of these cells to certain conventional cancer treatments such as chemotherapy and radiation. Because of its inherent alkalizing properties, baking soda, sodium bicarbonate, has been researched for its potential ability to modify the pH level in the immediate vicinity of tumor cells. The hypothesis is that by neutralizing this acidity, baking soda could create conditions less favorable for cancer cells to spread and thrive, and potentially make them more susceptible to standard treatments. One of the most frequently cited and intriguing pieces of research in this area was published in the journal Cancer Research in 2009. In this preclinical study, researchers administered sodium bicarbonate to mice with metastatic breast cancer. They discovered that this treatment significantly decreased the acidity within and around the tumors. This crucial change in pH was observed to inhibit the further spread metastasis of the cancer and importantly appeared to increase the sensitivity of the tumor cells to certain chemotherapy drugs. These results compellingly suggest that baking soda, by counteracting the acidic microenvironment that tumors often create, might have the potential to enhance the efficacy of traditional cancer treatments. Researchers are currently exploring whether antacids, including baking soda, can be safely and effectively used in conjunction with established treatments like chemotherapy or immunotherapy to improve patient outcomes. However, it is absolutely critical to stress that this research is still in its very early phases. While the outcomes observed in animal models are encouraging and provocative, extensive human clinical trials are required before baking soda could ever be responsibly recommended as a component of a standard cancer therapy regimen. Baking soda should absolutely not be viewed as a standalone cure for cancer, nor should it replace any prescribed medical treatments. It is best considered at this stage as a potential adjunctive tool that might eventually supplement current medical interventions if proven safe and effective through rigorous clinical trials. If you or a loved one is undergoing cancer treatment, it is paramount to always consult with your oncology team before trying any new supplements, dietary changes, or alternative treatments. Self-treating with baking soda for cancer can be dangerous and could interfere with proven medical therapies. If you're on a quest for a quick, effective, and entirely all-natural way to stay fresh and confident throughout your day, baking soda might just be the surprisingly simple solution you've been looking for. Sourced directly from your kitchen pantry, baking soda offers a straightforward and remarkably efficient alternative to many commercial deodorants, which often contain a cocktail of synthetic chemicals, artificial fragrances, and aluminum compounds that some people prefer to avoid. The secret to baking soda's deodorizing prowess lies in its dual action ability. It can both absorb excess moisture, helping to keep you feeling dry, and more importantly, neutralize the acidic substances present in perspiration that are primarily responsible for causing body odor. When bacteria on your skin break down sweat, they produce these acidic byproducts. By neutralizing these acids, baking soda creates an environment that makes it significantly more difficult for odor-causing microorganisms to flourish, thereby keeping you odor-free even on your busiest and most active days. The efficacy of baking soda as a natural deodorant isn't just based on anecdotal reports or traditional wisdom. It's also supported by scientific observation. A study published in the Journal of Cosmetic Dermatology found that when sodium bicarbonate was applied topically, it significantly reduced underarm odor. The researchers attributed this effect to the alkaline properties of baking soda, which, as they noted, efficiently neutralized the offensive odor generated by the interaction of bacteria and perspiration. Furthermore, because baking soda is generally free of parabens, aluminum compounds, often a concern in antiperspirants and artificial perfumes, it presents a fantastic choice for individuals with sensitive skin or for anyone consciously seeking to minimize their exposure to potentially harsh synthetic chemicals. Using baking soda as a deodorant is incredibly simple. You can just sprinkle a tiny amount directly under your arms. Alternatively, some people prefer to mix it with a little coconut oil or shea butter to create a paste for easier application and added skin hydration. Many users find that it effectively keeps them feeling fresh and dry even in hot weather or during strenuous physical exercise, despite the fact that every individual's skin chemistry is unique. And some people may need to test for sensitivity, as pure baking soda can occasionally be irritating to very sensitive skin if used too frequently or in large amounts. Baking soda remains a popular and enduring option for those seeking a natural, budget-friendly, and environmentally conscious method of personal care. If you're ready to explore an alternative to conventional deodorants that might contain chemicals you'd rather avoid, give baking soda a try. It's an easy, scientifically supported approach to staying confidently fresh throughout your day. Even while baking soda boasts an impressive array of amazing health advantages and versatile uses, it is absolutely vital to understand that it is not a universally suitable remedy for everyone, particularly when considering internal consumption in higher doses or for frequent use and even for certain external applications. Some specific groups of individuals should exercise significant caution or avoid its use altogether without explicit medical guidance. For instance, people diagnosed with kidney problems or impaired kidney function must be exceptionally careful due to the considerable sodium content inherent in baking soda. Compromised kidneys may struggle to efficiently flush out excess sodium from the body, which can lead to serious complications such as fluid retention, elevated blood pressure, and an increased burden on the cardiovascular system. Similarly, individuals suffering from high blood pressure hypertension should also approach baking soda with extreme caution. The sodium concentration in baking soda can potentially raise blood pressure levels, which is clearly dangerous for those already working to manage and treat hypertension. Furthermore, anyone with pre-existing gastrointestinal conditions, including gastritis, stomach ulcers, or severe acid reflux, should consult with their healthcare provider before using baking soda internally. While it can neutralize stomach acid temporarily, frequent or excessive use can disrupt the natural pH balance of the stomach and potentially exacerbate these conditions or interfere with digestion in the long run.